What Maryland did between 2007 and today was go from 44th in the country in healthcare for adults to 16th. From 44th to 16th. I want you to remember that. In terms of people, what that has meant is we've expanded healthcare to over 55,000 uninsured parents and over 65,000 uninsured kids. So we had over 100,000 drop in the number of uninsured in Maryland, which is tremendous progress. Well, how did we pay for that? We paid for it in three ways. One, federal matching dollars for Medicaid. Two, smart use of reduction of uncompensated care. And three, a $1 increase in the cigarette tax, which was enacted in 2007. That $1 increase in 2008 caused there to be 74 million fewer packs of cigarettes sold in Maryland. 74 million fewer packs of cigarettes. Maryland is now the fourth lowest smoking rate in the country. Fourth lowest smoking rate in the country. And I want you to brag about that to everybody, especially with Delegate Robinson and Delegate Rosenberg here who played a leading role in this issue. We have made tremendous progress. Now, these are numbers. Let me tell you about a person who typifies and really makes a great example of what this means. This progress we made, as I said, was bipartisan. The Republican caucus adopted it now, or not going to cut it back. But the bill that expanded health care was supported by a third of the House Republicans. Republicans from across the state supported it. We did press conferences from one end of the state to the other with Democratic and Republican supporters of this legislation. And in Garrett County, we were there with Delegate Wendell Beitzel, Republican from Garrett County. We were celebrating healthcare expansion, and we had with us a woman named Crystal Moon. Crystal Moon was a young woman with a couple of kids. Her husband worked. She couldn't work. She was going to school, but they couldn't afford health care. They couldn't afford health care. She took her two kids into the local Department of Social Services and said, I know you have health care for kids. Can you give health care to my kids here? Can they get coverage? And they said, well, yes, ma'am, but in addition, Miss Moon, because of the new law that we passed under Governor O'Malley, you are eligible too. Miss Moon signed up. She was happy about that. A few days later, she wasn't feeling well. A couple weeks earlier, she would have slept it off and tried to, not go to the doctor because she didn't have insurance. But now she had this Medicaid card. She went to see the doctor. The doctor said to her after examining her, Miss Moon, thank God you came here. There was something developing that would have killed you. If you had not come to see me, you would have died. And Miss Moon only is alive because of that Medicaid coverage. She came to the press conference with Republican Delegate Wendell Beitzel and said to all of us these words, thank you for saving my life. I want to pass on Crystal Moon's comment to the Baltimore Jewish Council. You guys were there at the very beginning in making this happen, and you saved Crystal Moon's life, and who knows how many thousands of others. In addition to what I just mentioned, we're allowing young people to stay in their parents' health care up to age 25. We're reducing prescription drug prices for seniors. And we're allowing foster kids to stay on health care longer. We've become a smoke-free state. We have, since 2007, made tremendous public health and health care progress in this state, and you all played a critical role. Now, the 2007 law that expanded health care and brought us from 44th to 16th was designed to expand health care for parents like Crystal Moon, but also for childless adults. Unfortunately, because of the budget crisis, that never got implemented, which is where the Lorraine Sheehan Act comes in and your support for that. We are proposing a dime a drink increase in the alcohol tax to pay for help people with developmental disabilities and mental health problems and drug and alcohol abuse, but also to provide the money for the childless adults. Let me talk about the alcohol tax a second. The tobacco tax has worked to both fund the healthcare expansion and to reduce teen smoking, making Maryland one of the fourth lowest smoking rate in the country, saving many lives. We know from a study completed for us by Professor David Jernigan of the Johns Hopkins Bloomberg School of Public Health that a dime a drink increase in alcohol tax will also reduce alcohol abuse, save hundreds of lives, and save hundreds of millions of dollars. Now, it didn't pass this past session, but we did make a lot of progress in bringing up public knowledge about it and educating legislators about it. And let me tell you what we're going to do next, and this is what we need your help with. We have made progress over the last couple of decades because every election year we ask candidates, including incumbents, to take a position on an issue. Now, they don't like to do that at election time, but we say we need you to. We don't want you to say, it didn't come out of my committee, the committee yet. We want you to take a position. This summer, Delegate Rosenberg, Delegate Robinson, and all the 500 people who are going to compete for the House of Delegates of Maryland and the Senate are going to get a letter from us asking them to endorse the Lorraine Sheehan Act, the dime a drink increase in the alcohol tax to fund these necessary services and reduce alcohol abuse. What we need you to do is to tell these candidates that they better sign it. So next time during the summer when a candidate comes to one of your forums, raise your hand and say, have you signed the Lorraine Sheehan resolution yet? I'll tell you a funny story about this. You know, candidates hate pledges, right? And we used to call these things candidates' pledges. In 2002, I was talking to a delegate and I said, we're going to send you a pledge on a tobacco tax. She said, I hate pledges. I'm not signing any pledges. I said, delegate, what if we call it a resolution? Okay, I'll sign that. So, we're not calling it a pledge. It's a resolution, and we ask for your help, the Baltimore Jewish Council, as an entity, and all of you individually, to make sure every candidate who comes to you for help signs that. And we believe with this we can achieve the Lorraine Sheehan Act in Maryland.
The bills had good hearings. It passed the Senate intact. It would have generated, as written, $9.1 million in revenue from the filing fee surcharges. It passed the House with amendments. The revenue would have generated only $4.5 million. It also included a 3-year sunset amendment and what came to be known as an oversight amendment with regard to Maryland Legal Services Corporation. I think there are legislators who are uncomfortable with the fact that they don't have more control over the grants that we make, and we're very vigilant about that not happening. We think the worst thing for any robust, true legal aid system would be for the grants to be politicized. In any event, we do have what's called an oversight amendment for informational purposes only. Both of these bills were passed relatively early in the session. We did not have a conference committee appointed until the Friday before the session ended. We did not have an agreement of the conference committee until 9 o'clock on Sunday night. And I am delighted to report to you that the bill passed with the amendments added by the House, so there's a 3-year sunset on this. And the reason for that is, legislators felt uncomfortable with the fact that we might have a windfall. It's very hard to convince people, quite frankly, particularly in a time when the economy is so terrible, that we're always chronically underfunded, and that. But in any event, the crisis at this moment was because interest rates are 0. And we know that interest rates can't get lower. That we know. So at some point they are going to start to come back. And when they do, our income will increase. And when the 3 years expires, we'll go back to the legislature and see where we are. But we ended up with a bill that we're estimating will generate $6.1 million. We're in the process of making our grants for fiscal year 11 as we speak. Our fiscal year starts July 1. And we are going to be able to restore our funding levels to pre-Great Recession levels at a time when the need continues to be, extraordinary. So this was just an absolutely amazing result. And it truly took, it was just a tremendous coalition and collaboration of which you were part. And it's very clear to me that we still, as a community, need to do better at educating the legislators about who we are, what we do, and why this work is so critically important